And good afternoon, Charles Moscowitz here. And my guest is Gary Goldman, CRN Radio in Worcester. He does a financial program, it discusses issues of the day, of course. And of course, what else can we talk about, Gary, but the pandemic? And I mean, now that we're all locked away. I want to talk about what we can expect, mostly here in Massachusetts, with regard to the gradual reopening of the state. But before I go there, I want to ask you if you have any knowledge about what businesses can do with regard to accepting these loans with all the strings attached. A friend of mine has said that he's accepted the loan, and he actually got a $50,000 loan, but he doesn't know what to do with it. He's afraid to touch it because it has all these conditions, and he fears that he may end up getting stuck with it. What do you hear about that?
Is it the PPP loan you're talking about?
Yes.
The PPP loan, my suggestion is, and on the consulting side of my business, I have a lot of clients who applied for it and received the money. But I've told them to make sure they have long discussions with their accountant and their attorney to make sure what they're up against. Look at if the employees don't come back to work, and there's just so many different angles of that quote unquote grant status can disappear quickly, and then you're stuck with a loan that has to be repaid in a very short period of time too.
Right. So maybe as a matter of precaution, it's not a bad idea if you don't know what to do to just leave it there and wait. And then if the situation comes up where you're asked to repay it, then you can just simply send it back to them at that point.
Exactly. And that's the key. How many business owners have that willpower is the other side of the question. You have to be very careful because of the dynamics, the way things are changing right now. But that's great advice. And again, they have to talk to those who surround them. Like I said, accountants and lawyers, they're accountants and lawyers on a regular basis to get the best advice.
So Massachusetts, according to Governor Baker, is talking about a gradual 4-stage reopening starting this coming Monday. And the governor has said he's not going to be specific about what that means until Monday. And he's advising us as business people to check the CDC and other legitimate sources in terms of what to expect. What do you see coming down the pike, and how do you think that should go, Gary?
Well, I like Governor Baker. I'm a little disappointed that committee that he put together was put together at such a late period of time. That should have been on the road and running right when the pandemic started, when we started closing things down. But with that said, I don't know what he's going to tell us on Monday. I think it's going to be a very limited opening. I think the problem is the science, the reality on the ground, and the need to get the economy going are all sort of meshed, and we're trying to figure out how to get them going and how to make everybody happy. I think he's going to start with those businesses, as he said, that have very little, one-on-one contact, and then work his way up from there. But they keep throwing in that line that if things change or we get a little spike, things could change in a heartbeat. There's no doubt we may see a little spike once people start interacting again. So I'm not sure, to what degree they're going to play that. But I really don't get a good feel of where the governor is. He's been pretty much tight-lipped on what he is going to open on Monday. All in all, we've got to get commerce moving again here in the Commonwealth. I really think, Charles, every day that goes by, it becomes more and more difficult for a recovery this year, number one, and it becomes more and more difficult for quote unquote small businesses, the real small, not the SBA definition of the small business, but the small business guy,
Right.
gal there to stay alive and keep their businesses open.
Oh, I know, the mom and pops, the small restaurants, and also some of the big players apparently are declaring bankruptcy, including Neiman Marcus and several others, and that's terrible.
Right. No, and I believe I'm always a guy that's glasses half full. I do believe things are going to get better, but I think we're going to have some difficult times before we start riding that wave up again. No matter what, even if the market shows some signs of jumping forward as businesses start to open, the reality is on the ground that is going to take some time to get the businesses open and to psychologically change the attitude. Georgia, where we've opened businesses, you're seeing people struggling to find that safe zone where they feel comfortable going into stores or
Right.
You
So
know,
a lot of it has to do with the confidence of people to go back out and to start to function. And you bring up Georgia. I think it's a good example of a state that's now been at least partially open for over 2 weeks, and there has not been an uptick in new infections that we know of. Of course, people are walking around with this infection without knowing it. We get that, but the visible ones and the hospitalizations have not changed. So those, I think, are good signs that and Atlanta's probably a city that's about the same size as Boston.
right, right.
So I think we could look to that as at least an encouraging template.
Right. And look, it part of the uptick in cases is also we're doing 10 times the amount of testing that we did a month ago. And the mainstream media really fails to bring that out when they talk about jump in cases or wherever it is. But I think Georgia is and a few other states are setting the tone. It's going to be, a little bit at a time, but as people build confidence, I think we'll see, the economy start moving. But the fear on my part is look at when I listen to Mayor Menino, Mayor. I always say Mayor Menino. I was
He was around for 30 years.
Mayor Menino.
Yeah.
So Marty Walsh and the governor, they throw in these little caveats that make me worried, and I think they create a little doubt in the mind of business owners and consumers, and that is the part that we have to get over.
A lot of people feel that they are not going to be completely confident in terms of going out until there is a vaccine, which of course might be as soon as the end of this year, but it's still a ways down the road. And yet there are also some nations in the world, from my studies, are treating the situation by using hydroxychloroquine as a preventative. And of course, that's not a perfect drug by any means, and no one should take it unless they have a prescription, like any other drug, under a doctor's supervision. But my understanding is that if you take 10 doses of hydroxychloroquine along with an antibiotic, then you really kind of have shielded yourself from the disease. And again, I'm not a doctor here, so I'm not speaking as one, but I wonder if our medical establishment is looking into that. Is there some kind of a preventative that one can take to help boost one's ability to fend off this disease? Do you know anything about that?
Well, when you look at Sweden as an example of a country that used that medicine as a proactive basis, it seemed to have great results. My concern in this country was that the fact that the president was behind this drug, and I think politics got into play with people because President Trump liked it. President Trump talked about it. They sort of were against it. I know. And look, I talked to a doctor off the record. I tried to get him on the show, and he made a comment to me that is stuck in my mind. And he said to me, I think the American people, when they find out that that drug could have and should have been used to a higher degree, would have saved a lot of lives, are going to be very upset with a lot of different people within this country. And I firmly believe we are, Charles, we're going to find that out at some point. It became too much of a political issue.
It did, because it fed into this anti-Trump sentiment on part of the big media. And that if Trump likes it, therefore they must be bad. Orange man likes it, has to be bad.
Yeah, no matter what it's doing for the what it would do for the people. But we need, I don't know, I'm not a doctor either. I have brother in the medical field and a daughter in the medical field, but I don't know enough about this virus. I don't think the experts really have a firm grip of what's going on with it, the way it's mutating and different things that are happening.
Right.
And that's why that hysteria, we've got to be very careful what we say. And when Dr. Fauci comes out yesterday and says, we got to rethink possibly opening schools in the fall, I think that's dangerous conversation. Very dangerous conversation.
Right, and he was challenged by Senator Rand Paul and others. And, in a way, we should be talking about, yes, there are dangers, but how can we proceed in a way that protects people to the degree we can? It's not. And also, I think you mentioned the example of Sweden. Sweden went ahead and they protected the most vulnerable people who very well their life would be at risk, like people in nursing homes or assisted living, and people who have pre-existing conditions like they're obese, or they've got high blood pressure that's not treated, or diabetes that's not treated. And everyone else was essentially conducted business as usual with a certain degree of sensible social distancing and improved hygiene. And I don't think that the numbers out of Sweden are all that different
No.
than the numbers out of other countries that did the complete stay-at-home shutdown.
No, I agree with you. And look, it's even in the state here in Massachusetts. I was watching one of the news channels this morning, and they were talking about the problem within our nursing homes. With everything that we know about isolating and the proper care we should be taking within these facilities, we're still not there yet, which really surprises me. We brought a lot of assets into the state, these temporary hospital capacity. I don't think really went over much over 50% at any one point. The temporary hospitals are all closing down. We've got to go to where the most susceptible people are and where this virus can fester. And to me, that's obviously among a certain age group. We know where these people are. And then anyone that's in danger, we have to find a place to isolate them to make sure that they're not in harm's way. We're not there yet, I know, in this state. I'm not sure we're there throughout the country, but that's something we really have to work on if we're serious about getting things back to normal.
No, that's right. And I think that some of these big city hospitals, and like the Heinz Convention Center here in Boston, you have the Worcester Centrum. I don't know, what are they calling it now?
I can't think of the name, but
but
Centrum myself.
I mean, I remember seeing the Who there back 20 years ago. But anyway, they've been fitted for hospitals, and really there's been no one in there. I mean, the one in Boston, it was fitted for, I think, 2,000 patients. There's no more than maybe a couple of hundred, and those are mostly homeless people. It's not even an issue. I mean, the news is showing these empty buildings. And I think it's probably cost the state and the federal government billions of dollars to do this, and it was based upon projections coming out of the CDC that were completely untrue. But, you mentioned the importance of protecting nursing homes, which is a very important issue morally and in every other way. This is where many of us have parents and have relatives who expect to go there and be protected. And in Massachusetts, they have, from what I understand, a very good policy in that if someone has the disease and they don't have a place to go and they're being let out of the hospital, this state has hotels that they use. Like there's one in Weymouth, there's one in Revere, where people go there, and they're basically, there's a staff there that's in place to help them and handle the situation until they recover. But apparently in New York State, the governor signed an executive order in March that mandated hospitals send people with the active virus to nursing homes. And the result, of course, has been thousands of deaths. A large percentage, I think in New York, it's about 50% of the deaths from the disease were in nursing homes. I mean, this is such an unconscionable policy. I mean, now they've reversed it after the fact. But I would think that if Andrew Cuomo was anything but a liberal Democrat, he would have to resign.
Oh, there's no doubt about it. I mean, I think the state of New York has some serious legal issues ahead of them. They were strong-handing facilities that would say we don't want to take that person, that we're not equipped to handle or bring someone in with that. So I think they have a lot to say. And here in Massachusetts, a large percentage of our deaths did come from nursing facilities. Right. My point, I think we really have to, if things start to settle down, whatever settle down really means right now, but we have to really focus on the nursing facilities because there's still a lot of cases, there's still a lot of deaths coming out of them, and we don't want those to be facilities where the disease festers and those that work there then go out into the general public, and here we go again. So
that's right. I mean, in a way, we're doing it completely backwards. We should be protecting the elderly and people in those facilities and people with conditions and letting everybody else conduct their affairs, but instead we're hurting those people by putting infected people in the facilities, and we're telling everybody else to shut down. We're all stuck inside, and the result is that our immune systems are being compromised. We are being affected negatively. People who have health problems are being affected. There was just a woman, I believe, in New York who died because she couldn't get treatment for pregnancy that she otherwise would have gotten, but the problem is the hospital is only handling COVID. So you have people putting off needed medical care in areas of cancer, heart disease, and other ailments because the hospitals are strictly focusing on COVID, and the numbers of people with COVID is declining.
Right. Look at the hospital. Talk about financial instability. Our hospitals are going to be in big trouble. They make a lot of money off of elective surgeries. And what people have to understand, Charles, elective surgery doesn't mean, do it when you can. That's just the term they put on the surgery. There are many people that need a procedure done to find out what else may be
Of
going on in
course.
their lives that are not being taken care of. And that's what concerns me when I listen to the mayor and when I listen to the governor. I think the hospitals have a lot of room. The numbers are down. They have to have a plan to get people back in to get the treatments they need. And again, was it 2 weeks ago we put that committee together of 17 people? I firmly believe that should have been put together, Charles, from day one. That didn't happen.
Exactly.
I would hope that we're working to get the hospitals open so we can get people in there. Look at the health insurance companies are going to pay a price for this with extra medical costs for people that are sick that may have been able to subside some of their problems, but now they get to another levels. That's all about cost, all about money. Never mind what it does to family and friends.
Yeah, not to mention, and again, elective surgery is not a boob job, you
Right.
know.
Yeah.
I mean, these are serious situations. Not that those aren't also there. Uh, Gary, so going forward, as the numbers come in and as we see that there has been a marked decline in the numbers of known infections due to testing, which has increased, and the numbers of hospitalization, according to today's Boston Globe, I think that the state is going to gradually open up. Even if the state says it's not going to open up, people are going to start to go out. When the weather gets hotter, people are going to go to the beach. They're going to go out to the parks. It's just not going to happen no matter what the state does. And I think that this information trickling out is only going to add to the confidence. So how do you see things going forward as we enter into the summer? And do you think that what is the state and this country, for that matter, going to look like let's say in July?
Look, I'm hoping by July some of the fear factor is gone. I think that's what we really have to get over. People are at beaches, people are out. Somehow we figure out a way to open restaurants up again. Look at whether we could get back to normal, what was normal. It's not going to happen because they're making it perfectly clear there'll be a new normal. So whatever that new normal is, we need to get there. We need to keep moving forward. I think as people feel more confident, they don't see any, spike in this virus. They're going to be doing more and more because people will become complacent. Once they feel good again, they'll just start moving things along. Again, it depends how hard and how strong the governor and in our case, the mayor in Boston are going to hold things. If they allow people to move along as they feel fit, as long as they're keeping quote unquote their social distancing, I think we'll be okay. If they try to rule with an upper hand, it's going to be difficult. But I firmly believe summer months, people are going to be, you can't stop people from going to the beaches. You can't stop people from going out and doing things. Look, they've canceled just about every event. We'll see how sporting events work. I don't think we're going to see people sitting in stands, but it'll at least be helpful to see it on TV. But I think we'll get there. It's going to take time. It's all about confidence, and it's all about the hysteria. If the media would lay off some of this hysteria and negative talk, it's difficult to watch the news in the morning.
Oh, it is.
All negative. Even if it's a positive story, it's negative in some regard. So
yeah, it's all panic reporting.
Right. But I think we'll be okay. I think it's going to take time to get back to where we were. I really believe that. But we can get to some happy median. And I think so long as we're being led in the right direction with positive reinforcement, we can do that. Not to sugarcoat something if there's a problem, but we shouldn't be hearing information based on just maybe one's opinion as opposed to their fact. If you're going to make a statement, you have to have the facts to back it up and not projections and models. The projections and the models, I think, have done more harm than good.
Oh, and they've proven to be quite wrong. I mean, they were like, there's going to be 1 million deaths in America. This kind of horrendous reporting early in April, has turned out to be not true. And I think that once we start getting back to work, I hope the media doesn't, take a few cases that might come up and put it up on the flagpole and magnify it and scare the crap out of everyone. Instead, maybe we should look at possibly an outbreak in a certain area and then take necessary measures in that area, but not create this mass across the board fear that we all have to start shutting down again.
No, we have to. That would be the worst thing to do. And I would hope they have a plan to isolate. I think we know where a lot of the hotspots are and where they've come from. We've got to be able to isolate those and move forward. And I would hope that they do that. But, I think we may have even discussed it. The winter scenario of when we're going to get a foot of snow, 2 feet of snow, and you wake up because some computer model said it, wake up, there's an inch of snow on the ground. That's what I felt like at a lot of times with the projections in regard to the virus. Virus, obviously, a lot more serious. But the numbers have not really, the projected numbers do not match what's happening in real life around us. And I think people have to be aware of that.
No, and it's a whole separate subject that I should probably do a show on. But this whole business of computer projections anyways is very faulty. I mean, the whole question of global warming is based on computer projections, not based on any actual observation. I mean, last winter we had Mayor Walsh cancel all schools because of a snowstorm that never happened because of computer projections. So that's a whole different ball of wax for another day. But Gary Goldman, let my listeners and viewers know where they can get information about you and your work. And I know you're at WCRN in Worcester. I mean, please let us know any websites you'd like to.
Yeah, so they can find me at GaryOnBPL.com. That's GaryOnBPL.com. They can email me at Gary@GaryOnBPL.com, and they can listen to Business, Politics, and Lifestyles every Saturday from 9 to 11. And as I told you, we're working on a platform to be out there every day of the week. So Excellent. It's a good thing going.
All right, Gary, listen, thanks a lot for joining me.
My pleasure. Nice speaking with you.